Okay, so I'll just continue on. We're talking about the very first session of Baby Mama Dance, which the theme is how we move. So how we hold our bodies, how we move in our day-to-day lives, and how that affects not only holding patterns, so creates habitual kind of ways in which the body holds or senses tension, how that relates to pain, ailments, kind of, I suppose, like a lack of ease within the body. So often when we're with baby, we have a tendency to kind of prioritize the baby's body. So if you're really thinking about how we're holding the baby and the baby's head, but we're not often that conscious about how we're holding our own bodies. So when we are thinking about how we're holding our own bodies and how we're holding the baby, then we are in flow, then our body can have a sense of equilibrium. Obviously, after birth and in the first few months of healing and recovery, the body goes through quite a few stages of kind of drawing itself back in. So it goes through a process of really restoring and reintegrating within the whole. And that process can be eased through daily stretches that acknowledge the pelvic floor, pelvic tilt. So just how we're using our pelvis and how we're holding our pelvis and how those pelvic muscles are healing and recovering, regardless of the type of birth we've had. And also just, I suppose, when we're with new baby, you know, we're holding the baby to sleep or we're placing the baby down to sleep. So it's just really about how we're using our bodies during the day, but then also during the night too, because often during the nighttime, if we're waking up for nighttime feeds, you know, we can, if it's winter, we can be sitting and getting cold, so we can get chills, but also you can get sore shoulders on one side or a sore neck on one side. So there's lots of different ways in which we develop habitual patterns in the early days of mothering. And I think primarily that's because of two things. The first thing is that we've really focused on the baby. So we've really, you know, working hard to make sure the baby's body is well supported, and also that, you know, quite often if it's your first baby, you kind of go into a little bit of a survival mode. So you're just really thinking about day to day, minute to minute. You know, has the baby had a feed? Is the baby hungry? Is the baby cold? Has the baby thrown up the feed? Is the baby pooed everywhere? So because we're really dealing with the day to day and the minute by minute kind of concerns of early motherhood, it's quite easy to not only forget about ourselves, but it's also quite easy to forget about our bodies. And so the most important thing I would recommend is that you're practicing either a dance or stretch or yoga sequence. Try to do it at least every day if you can. I know it's hard. It can be really, really short. It doesn't have to be long. Soon I'll be making a little bit of a video introducing you to some of the birth dance practices that I've developed and used throughout my 2 labours and pregnancies and in my 3rd pregnancy. These practices really help to condition the body, really help to condition the pelvic floor. They're really, really gentle. They've been used throughout history in different cultures, so they're organic and they're intuitive. If you can integrate those practices in not only leading up to the labour and then in the early days of motherhood, it's going to really help you to make sure you're maintaining the integrity of your body. So you're really using your core whenever you're lifting or moving baby or rolling over to feed or whatever you're doing with your body. It just really helps that you're maintaining your integrity in your core, that you're staying really, really centered in your whole, and that's going to help you sleep better. That's going to help you care for your baby better, because ultimately, if mum is not feeling well, if mum's body is out of adjustment, is in pain, is developing holding patterns, then that's going to reflect on baby. So yeah, my recommendation would be to try to do at least 5 minutes, if not 5 minutes in the morning and then 5 minutes in the afternoon, just to really focus on yourself. Sometimes you're so exhausted, you might spend the whole day in bed, baby's feeding every 5 minutes, or baby might be sick, or whatever's happening in your household. Sometimes it just feels like there's not any time to develop and devote to yourself. So if that's the case, I would say even just sitting up in bed, doing some pelvic tilt or some pelvic floor exercises, even just closing your eyes for 5 minutes and creating a little meditation. So just taking a little bit of space for yourself to give back energetically, and just always reminding yourself that in the early days of motherhood, you're just taking every minute as it comes, rolling with the punches, trying to keep your head above water, smiling, reaching out to people if you need help, and ultimately remembering that these early days are the most beautiful, the most intuitive, the warmest. This little baby isn't even ready to be in the world yet. This little baby's just come out and is just ready to be with you. And I know that's overwhelming, and I know that's full on, but these early days you'll miss. The baby's going to start crawling, the baby's going to start walking, the baby's going to go off to school, and these early days will be over. So cherish them. If you're pregnant and you're waiting for your baby to come, really create mindful moments within your everyday existence that you take time out for you and your body to stretch and restore and prepare. I look forward to sharing more of this work with you. My name is Lucille. I run Swag Mamas. Thank you for your time.